By I 103.8.
Is it true that cheese gives you nightmares? Are we all a bit dairy intolerant, whether we know it or not? From bloating to bedtime bellyaches, we're tackling some gut-related myths that are doing the rounds online. Joining us in studio, Dr. Mazin, consultant gastroenterologist at Mediclinic. He's there at Parkview, and we are sorting science from social media and answering your most pressing gut questions. So whether you want an expert second opinion, some clarification, don't be shy. No such thing as a silly question. Dr. Mazin, how are you?
I'm good, darling. Thank you for the invite.
I'm intrigued. Why did you want to specialise in this area, so to speak?
Gastroenterology. Well, as they say, somebody has to do it. I did everything. I did cardiology. I did pulmonology. But then I loved gastroenterology because there's intervention endoscopy with it, and there is also seeing patients in the outpatient. So you're not sitting in one place. Mm-hmm. You're all over the place. And I'm one of those people who's hyperactive. So that's why I went to do it.
No day is the same.
No day is the same. Exactly.
Right. Well, as I said, we've stolen you from a very busy clinic for an hour to answer. I mean, honestly, some of the headlines you see are so confusing. Yep. There's so much misinformation out there. Right. And it's really hard to know who and what to trust. So I saw a headline this week and I was like, I think we need to get a doctor in, saying, are we all a bit dairy intolerant? And I wanted to ask you that. You know, is that an online exaggeration or is there any medical fact in that?
Not entirely exaggeration. So when we are born, we do have the lactase enzyme, which is the one that digests the lactose for you, which contains in anything, milk, dairy products, cheese, whatever. But as we grow older in age, the enzymes, all of us, the enzymes decline. So you're not intolerant, but you become a bit more sensitive. If you eat cheese and pizza at the same time with you're above the age of certain age, you have problems. But when you're a child and all that, there's no problem. But there are also sensitivities when you're a child.
Can we maybe nail down some definitions? I think a lot of people find this confusing. When we talk about sensitivities, intolerances and allergies.
Yes. Well, look, when we're born, we all have the enzymes levels. When your enzymes becomes less than the normal, you're sensitive to that product.
And what might that look like in symptoms
in
practice?
Let's say you ate some cheese today and you'll have some bloatedness and gases and it will go away in half an hour. Others who are intolerant, who do not have the enzymes when they were born, and these are genetic issues. This is very rare, by the way, very rare, because everybody, and I can see in the clinic coming to say to me, I have lactose intolerance. No, you do not have lactose intolerance. You have some sensitivity, which might be due to bacteria, which we'll discuss later on. Mm-hmm. So those people who are intolerant, within half an hour of eating, they'll be either on the ground with tummy pain, bloatedness, diarrhea, they can't go out. This is real lactose intolerance, and this is very rare.
Okay. And then allergies.
They're not allergic.
It's not allergic.
You're not allergic.
Okay. Is this a modern problem, or do you think this has always been the case?
No, it is. You're absolutely right. There is some, we're all eating processed food, so it's affecting the lining of our absorptions in the intestine, and this can affect the absorption of the lactose, which is the lactase goes down, certain type of infections, certain type of chemotherapy, celiac disease, inflammatory bowel disease can affect all these absorption issues.
Dr. Mazin, can I ask you what's coming into clinic right now? And I love asking this question of docs because I think it gives us such a read of demographic here and really, in honesty, a way of normalising maybe some of the questions we can help people with during the phone-in today. What are you seeing coming into your clinic? What are people worried about? Any patterns?
Okay. The commonest, if you ask any gastroenterologist, the commonest patient coming to the gastroenterology clinic is tummy pain, bloatedness and gas. Change in bowel habit, of course, with it, because the gas will lead to sometimes constipation. The bloatedness can. So all of these, one leads to the other. So this is the commonest things we're facing up in our clinics. Mm-hmm. And if you ask anybody in the street, I can't eat this. I might become bloated. I'll become gassy. I don't want to eat this. So they're suffering. They don't want to go out. Their quality of life has changed. So they want some really a solution for this.
I think this is a really important point. It's not just about, oh my goodness, I can't, put my jeans on, they're a bit tight. For some people, gastro problems, of course, can be very serious health-wise, but also mental health-wise. If you don't feel confident to leave the home or to not know where the nearest bathroom is or to go to a restaurant and not know what's on the menu and what that might lead to, your life can get pretty small pretty quickly.
100%. I've told you, I have patients, they calculate if they go from here to here. If they're going to Abu Dhabi, they have to calculate where they're going to stop, if there are any stops. If they're going with friends to a restaurant, is there anything during this way? So it's affecting them mentally. And rightly you said that. It's not just affecting your genes. Yes, most of our females also, look, I have pictures on my phone. They send them to me. They're flat when they wake up in the morning, 2-3 hours. They're like pregnant. They send, I look like pregnant. My husband keeps asking me this. So these things will touch on them, how to treat them and how to test for them.
I hadn't really appreciated this until I had a good friend. He's left the UAE now, so I can say this, who had IBS, and we went to Dragon Mart, right? Yeah. And can be stressful under normal circumstances, never mind with a little bit of IBS in the mix. And I remember as we arrived and parked, he's like, I just need to check where the loos are. And it was so kind of foreign to me that this was a very real consideration that he had to make. So for, as you say, planning time, just want to know, because as you can imagine, with anxiety, it got worse. Yeah. And it kind of really struck me that, you know, when you do have, I guess, a healthy, functioning gut and bowel system, that you kind of take it for granted. It's a bit like having good eyesight. You kind of go, oh, it's weird that people would have to wear glasses or have to make considerations or think about it. Yeah. So we are talking about anything and everything this afternoon. Can we talk about cheese? Because I really don't want to give it up. And if you're saying that we're all maybe a little bit intolerant, what are some of the signs that maybe you should take the symptoms a bit more seriously and start making modifications to your diet, doctor?
Well, I think first of all, let's say what are the types. So you have the primary type, which is the most common type, the primary deficiency, which is basically as we grow older in age, it declines the enzyme, and this will lead to symptoms. The secondary, which is we mentioned due to infection, multiple courses of antibiotics, celiac disease, whatever. And you have the genetic one. And you have the one that developmental one, which is premature babies and all. Now, the signs of symptoms with these patients will be bloatedness, gases, distension, cannot go out of their house unless they go to the toilet first, because they know they will rush to the toilet. They'll have liquid type of stool, they have watery stool, they have mucus in the stool, and they start losing weight because they're having lots of diarrhea, absorption issues.
Gosh.
Yeah.
Can we talk about, is it SIBO or SIBO?
SIBO, SIBO, either way, English and American.
Oh, okay.
Yes.
What's the English way?
Tomato.
Urban. Small intestinal bacterial overgrowth. What is it, and what do we need to know about it?
And this is one of the things that are close to my heart, because when I came here from the UK, there were no machines for this. So we got the machines, which is simple test, which is a 3-hour breath test there. This breath test, they get them to drink something containing glucose and lactose, and they breathe into a specialized machine for 10 seconds, 20 seconds, every 20 minutes, over 3 hours. And this gives us the graph of how much bad bacteria you have. And this is why it's called small intestine. It's in the small intestine, bacteria overgrowth. So this too much bacteria can cause you to have loss of absorption, affects your sensitivity to the lactose because it reduces your lactase enzymes. So the treatment for it is something simple, a special antibiotic with probiotic and digestive enzyme.
But you know exactly what you're treating.
Exactly.
Okay.
Now, there is another test, which is the methane test, that's only for gases.
And that's the other end.
Yeah, that's with the constipation end.
Put a message here saying, amazing, Helen, just catching the show and guessing he's Dr. Mazin. He's treating me as well. Hi, Doc. That's from Alistair. So your fans are listening and we've got messages coming in. Okay, Doctor, tell us straight. Is there any science behind this idea that cheese will give you nightmares?
I think you're talking about one of the studies that happened, I think might be in Australia, where they asked 1,000 students about this, saying, okay, you eat this cheese and we'll come and ask you with a questionnaire. And they had a link between these students who having nightmares, who ate more cheese than the others. And they did the questionnaire for them. But yes, it can cause, because we have indigestion, anybody who has problems with the stomach digestion issue, if you've ate heavy meal, you'll have nightmares also. So they didn't go through other parameters, but they were concentrating on the cheese. But they didn't go tick the boxes for the other issues they were eating. So it can.
Nightmares aside, though, what and when you eat must impact sleep.
Yes.
How? Because I think we've all had those nights where you've maybe had dinner a little bit too late and you've gone to bed and you're like,
Yes.
Yeah. When is an optimum time to have your last bite of the day?
If you're sleeping at 12 midnight, your
No
last
chance.
meal is 8 p.m. For us, we sleep at late like this.
So 4 hours before.
3 to 4 hours, 100% you need for the food to be digested and getting out of your stomach. Otherwise, you'll wake up in the morning with some bloatedness, gases, reflux. Even some patients who have reflux and heartburn also can affect them. And also, of course, in the morning, the bad breath, because the food was stayed longer than usual, and that ferments and produces methane gas.
Doctor, decades of experience working internationally. I can't even imagine how many clients have sat opposite you in clinic. What do you avoid food-wise and what do you incorporate food-wise with your personal gut health?
My personal gut, well, I always tell all my patients when they come in. 1, avoid fatty food, fried food. Really avoid it. Once a week, you can spoil yourself. Grilled, please grill everything. Red meat, even the WHO guidelines telling you red meat twice a week, half the palm. So it's telling you this because there's a relation to the digestive tract, to the colon polyps, colon cancer. All of this is also related. So grilled food, avocado, nuts, a bit of nuts. You can have turmeric, yes. Some patients ask me about blueberries. Fantastic, antioxidants. The best things for you. And I always tell them, jog, brisk walk, half an hour before dinner. Not after dinner. They keep asking why. Because they tell us, when I eat, I want to get it out of my system. No, when you do it before dinner, your brain, when you come to eat, is going to give blood supply to your arms and legs, which worked. Your stomach didn't work. So when you come to eat, it's going to give it a little bit of blood supply. So you're going to eat a little bit. So this will help you also to sleep peacefully and lose weight.
So as a natural appetite suppressant is movement.
100%. It is a natural appetite suppressant.
Staying with the whole body, we are learning more and more about this mind-gut connection. And I wondered how stress affects gut health. Can there be emotional triggers that link to physical symptoms?
100%. There is the brain-gut axis. There is a nerve supply from the brain to the gut. So we call it BGA. That nerve supply, if you're anxious, stressed, at work, you've been disturbed by Melanie. Melanie gave you a hard time today.
I would never. She's amazing. But if you have got a nightmare colleague.
So these trigger that nerve supply, and your intestine either works over the top. You become distended. You have tummy pain. You have miserable days. Not that day only. Miserable days to come until you relax. And that's one of the reasons I tell you to go and exercise, because you will empty your brain after work. You will relax after work. You'll get everything out when you're doing that exercise, and you relax that. And the nerve supply will relax. Your tummy will relax. You'll sleep peacefully.
I had a really interesting, I don't use the word kind of breakthrough lightly, but it really was a revelation for me. So my youngest daughter is quite a picky eater, and she wasn't until she turned kind of 2 or 3. And it's become a bit of a ongoing emotional battle in our house, and we're now seeing an occupational therapist, and one of the first things she spoke to us about was about adrenaline, and saying when meal times are stressful, that adrenaline is going to deplete her appetite. So and the example she drew that I thought was really interesting is like, if you've got a big job interview or you're about to do a presentation and someone says, do you want a bowl of spaghetti bolognese? You're most likely...
You have butterflies, don't you? In your stomach, you're not going to eat anything.
No. So if a mealtime is stressful and you're going, sit down, what are you going to eat? You need to eat this. And, it becomes this...
Stress.
Of course, the appetite is going to reduce. And then a child will go, I'm not hungry. And then it becomes this kind of perpetual about, we're
cycle.
here now. And I hadn't appreciated that. And I wish I had sooner.
This is a vicious cycle. You see, when you're doing this, you're forcing them. You want to eat take this, or like a choo-choo train, like this and this. The child knows this. So automatically it's going to block that nerve supply for them. So they're not going to eat. And then if you leave the food for them on the table, go away from them, they'll come by themselves, they'll eat. If they're hungry, they will eat. So that's why you leave it there and move away. We are hands-on. That's our problem. We want to feed them. We want to make them better. This is the mistake that we're making. And that all of us, the same thing.
How do you feel about a little quick fire round of text messages?
Go ahead.
I should
That's what we want.
should just tell you some have come in literally this second. So you have not been prepped. You ready?
Yeah, of course.
I trust you.
Don't worry.
I think we're up to the job.
Thank you.
We've had a message here saying my 3-year-old complains of tummy aches after eating yogurt or drinking milk. Could kids be lactose sensitive even this young?
Yes, 100% they can be. Usually they start earlier when they're bottle fed or even breast milk fed. And at that stage, what they do, they grow out of it. They omit it for them for 6 months and then they grow out of it. But kids at this age, 3 years of age, we need to test for parasites, cysts, worms, and also SIBO. We can test for that.
We've had a message relating to reactions actually saying, I've just had an amazing, delicious lunch. And within half an hour, I got itchy nettle sting type bumps appear. I know I react like this to fish and shellfish, only for the last 16 years though, but I've always been okay with things like teriyaki and oyster sauce. Could it be due to using a different brand, or do I need to get tested for something else? Now, I know you can't specifically talk about Hannah here because you don't know. But my question is, and for Hannah and indeed anyone who's thinking about sensitivities, intolerances, allergies, there are so many dodgy tests around that are charging a lot of money. Yeah. So what, to your mind, is there a gold standard of tests? How can you really get to the bottom of what you should and shouldn't be eating?
There's no gold standard test. That's one. A lot of patients come to me and say, I need to do a food allergy test. We don't do it as gastroenterologists. Some GPs, yes, do it. In the Mediclinic also they do it. As gastroenterologists, we have a lot of suspicions about it, because if you do the test today, you do it tomorrow, different results. So it's absolutely not, because it's a blood test. You can't do a blood test on an allergic test. There is the patch test, which is more sensitive. And yes, there are some allergic tests. There is nothing 100%. We do several tests to exclude to reach a diagnosis for you. Some patients say, but you're doing these tests for me. Why? I've got so many tests. Guys, how am I going to exclude this for you? You have all of these symptoms which are related to irritable bowel syndrome, SIBO, inflammatory bowel disease, and other functional diseases. You have to isolate it. Celiac disease, you do a simple blood test. So one by one, we have to exclude.
Dr. Mazin, you said earlier that you don't touch fried food, that there are World Health Organization guidelines on the amount of red meat.
Yes.
And I feel like there has been a lot of hype around certain foods being very good for gut health. And I'm thinking about things like fermented foods, your kefirs. And I wanted to ask you if there's any truth in that.
Okay. I do touch fried food sometimes when we do it in the
just in case you spot him in a restaurant.
I don't want everybody to see me eating. He's eating it. Well, look, there are certain type of foods which are good, superfoods which are good. I'm sure you know the blueberries, the avocados, the turmeric, the kale, the quinoa. All of these, some of them has antioxidant effects, some of them have got anti-inflammatory effect. But we cannot. These superfoods have got large amount of nutrients with less calories, yes, but there is nothing replaces your diet and healthy eating and exercising. Nothing will replace it, whatever we say.
So if I go to the supermarket and it's talking about being, gut health promoting.
Yes.
There's a lot of marketing.
Well, look, I always advise patients on yogurt. Yogurt contains live, especially the one contains live probiotics, live cultures. These are fantastic, especially lactobacilli, bifidobacterium. These are very good for the intestine and your stomach. Also delays things like the lactose, so it allows the lactase to digest. So that's why yogurt is treatment now for patients when they think they're lactose sensitive. But I'm eating yogurt that contains milk. No, but the bacteria in it that ferments the lactase make you digest the food, the lactose. That's how it works.
There you go. I told you, sorting fact from fiction. I was just talking earlier about my picky eater, and we've had a message here saying my 11-year-old daughter is a very poor eater. She's healthy but weighs only 31 kilos. Mealtime has become very stressful for her and us. How can I remedy this? Now, there is a couple of things at play. One is, as I said, we're seeing an occupational therapist in terms of food behaviours and habits and familiarisation and whatnot. But the health piece is what I wanted to ask you, Dr. Mazin. If this patient and parent would come to you, what would you be wanting to establish?
This is very crucial. This is a child who's underweight. You can see that, and I'm sure the family has taken us for several doctors. One, we need to isolate a celiac disease, because this is one of the things that absorption. 2, any parasites which can eat with you when you're eating. 3, SIBO. And 4, mental. Are they having problems at school? I have so many kids when we go deep down, we find really there is an issue at school.
So ruling out, blood work tests initially.
Blood work,
with
stool
a gastro,
test, and a breath test.
Such as yourself.
3 things.
And then obviously it becomes a holistic
Dietitian,
thing.
we can get them all involved, all the pediatricians, everybody.
Tell you what, if you want to send me the word gut, by all means to 4001, I will send you the details of Dr. Mazin, who's in studio. Ryan wants to know, are those lactase enzyme pills I've read about actually effective or just a gimmick?
They are effective if you do have lactase sensitivity, 1, and lactose intolerance, 2. In addition to that, you have to rule out small intestinal bacterial overgrowth. What's the benefit? I'm giving you the enzyme while you have the bacteria is eating the enzyme is not helping you. So you have to rule out things. Some people use it, they're fantastic with it. Others use it, it's not helping, doctor. We treat the cause first, guys, before you take the other.
Mm-hmm. Yeah, but we all love a tablet and a quick fix,
Yes.
doctor.
Yeah.
We all want to pop a pill and have a pizza and a scoop of ice cream.
There's no quick fix.
That's disappointing. Speaking of ice cream, Trish has been in touch saying, hi both, every time I eat ice cream, I feel bloated and get cramps, but I'm fine with cheese. Could I still be sensitive to lactose?
Yes, this is what we said about the bacteria. This is what we said about the enzymes deficiency. It goes back always to do the simple test to find out. And I've heard this several times. If I eat this ice cream, I'm not with it. If I eat the other ice cream, I'm well with it. Well, both of them contain milk. Then there's a problem where? In the manufacturing. What are they adding? What are the additions they're adding?
Makes sense. And Sal says, I've heard that dairy can cause acne and make skin problems worse. Is there any real evidence behind that?
Yes, there is some allergic reactions. There is a link between the dairy products and the skin condition. There's also a link between SIBO and rosacea, acne rosacea. So these have to be ruled out before indulging into giving treatment.
I had really bad eczema as a child. Really, really bad. And we tried everything. And actually, I have to say, reducing dairy did make a big difference. But then it's so hard because you've got no counter.
Sometimes you grow out of it.
Grow out of it.
Yeah, you
which
grow
I
out.
did.
Exactly what we said. You see, you and I said the same thing. You grow out of it.
I did. So a message here saying, are there any ages, races more susceptible to food allergies? And that's interesting in terms of demographic, or does it have no discrimination? There
is no discrimination, but if you're used to European food and you go to an Asian area, yes, you'll have some sensitivities. Similar to, by the way, the lactose intolerance or lactose sensitivity is supposed to be more common in the Middle East, Far East Asia, rather than Europe, because they eat lots of cheese there. So the sensitivity here is more because they eat less, so they become sensitive. So there are different countries, different...
Here's a contentious question to end on, Dr. Mazin. Gut resets, cleanses, juicing for 5 days. Medically useful or a wellness buzzword?
Antioxidant is useful. If you're cleansing, some patients come to me, I'm going to do hydrotherapy, I'm going to do this. This is useless, guys. You're only getting rid of the good bacteria. Also, you need the good bacteria inside. So you will be fine for a month. What happens after that? Everything comes back. So you need to be tested, please.
Thank you so much. I've really enjoyed the no-nonsense approach to so much information out there. And I think, in honesty, it's just good to know that, first of all, you're very busy. but it's good to know that there are places to go. There are people. You don't need to live in discomfort. You don't need 100%. To be fearing those, unknown menus or 100%. Dragon Mart.
And don't just keep doing those tests, please. And picking up medication over the counter. See a doctor.
Root cause.
Yeah.
Afternoons with Helen Farmer.